So, welcome to The Grind. I'm your host, Mike, and today we're talking about what worries clients. Like, what are your clients worried about when it comes to life? And a study was done that we're going to review and take a look at. But before we do that, we still have some top golfs left over. May 12th, we'll be in Pennsylvania. May 19th, Indianapolis or Fishers, Indiana, just north of downtown Indy. June 2nd will be Schaumburg, Illinois, my old stomping grounds. I'll be at that one. So definitely join us there. June 16th in Detroit, and then June 30th in Westchester, Ohio. I'll be attending that one as well. So come on out, enjoy some Top Golf, enjoy some drinks, have some fun, hear from your local carriers, converse, all that good stuff. But before we jump into today's topic, GLP-1s, all your Wegovy and whatever else is out there, it's taking the market by storm because now the joke was, I just want a pill to lose weight. And now that's a reality. I can take a pill to lose weight. So CMS has taken note of the popularity of this drug. Now, the drug was originally designed, from what I could tell, again, I'm not a researcher, I'm not a physician, I'm not a pharmacist, but was really for your diabetics, and they realized that you could take it as a non-diabetic and lose weight, or you could take a GLP-2 and slow down your digestion, and feel full longer and lose weight that way as well. So before the market goes crazy and every senior runs to the pharmacist and says, "Hey, I want the weight loss drugs," CMS is like, "We just can't give it to everybody because that'd be way too expensive." But some people obviously need it. So from July 1st to December 31st of 2027, they're going to allow beneficiaries outside the Part D realm, if they qualify, for $50 a month to have a GLP-1. And there are a couple different brands that are available. Now, to qualify for this, if your BMI or body mass index is greater than 35, which means you're pretty obese, that you get it for the $50, no questions asked, you get it. If your BMI is 34.9 down to 27, you could still qualify for it as a Medicare beneficiary if you have certain other chronic conditions. So I have a basically an agent note or a quick agent review of this. I'm going to include in the post email along with the link to the Medicare GLP-1 bridge is what they're calling it. So you could also just go online and search Medicare GLP-1 bridge. CMS has an entire page on their website dedicated to this with a lot of FAQs. So check that out. But the link to that agent memo will be included in the post email. So if your client's like, "Hey, I heard Medicare covers Wegovy now. How do I get it?" It's like, well, here are the parameters. Of course, it still has to be prescribed. They have to get the body mass index. And if they're over 27 BMI, they can get it. Over 35, they can get it, no questions asked. So something to consider. Keep in mind for your clients and prospects who ask about GLP-1s. Now, there was a study done by Kaiser Family Foundation. If you're not familiar with Kaiser Family Foundation, they do tons of research in healthcare and other fields. So they did this big survey in this April of 2026, and one of the questions was, what are you worried about, right? What troubles you? And as you could see, healthcare costs was number one, with 30% being very worried and 34% being somewhat worried. So that means 64% of the people asked, and now this was, the general public, not just seniors, 64% said, "Hey, we're worried about healthcare costs," right? Now, it may not be as severe in the senior market because they have Medicare Advantage plans, Medicare supplements, but I could almost guarantee that I would say more than half your clients have some sort of hesitation or some sort of concern about healthcare costs. Now, as you can see, gasoline and transportation, I don't know about you, but I remember a few months ago, I was paying the cheapest gas in my area was like 2.30 a gallon. Now it's 3.99. So it's almost doubled in cost. And I know we pay less, not a lot of gas versus the rest of the world, but the fact that it went up so quickly is very troublesome. Food and groceries, monthly utilities, your rent or mortgage, all those things concerns. But again, healthcare costs still number one, even with the doubling of gas prices in the last few months. So very, very big concern. Now, when it comes to that, they broke it down a little further and it's like, okay, well, what of healthcare costs are you concerned about? And 46% said they want to pay less out of pocket. And this is basically go to the doctor, go to the pharmacy, go to have an emergency. A lot of people stress over the amount of the bill they're going to receive. And as you can see, almost half the people are worried about that. Now, prior health authorizations, obviously, that's a big one. Getting more value, that's one. Having a choice of what providers you could see was only 12%, and then none are 6%. So by far, almost all the other concerns still equal paying less out of pocket for healthcare because it adds up quick. And it's no secret that getting sick in America can be very expensive. So what this means for you, your clients want to spend less when it comes less out of pocket when it comes on healthcare. And this is why offering hospital indemnity, offering cancer plans, offering dental vision hearing, offering solutions where your clients can pay less out of pocket is vital for you as the insurance agent. Now, I know what you're thinking, but Mike, if I sell them another plan, they're going to pay more in premium. And that's true. Yes, there's no free insurance out there. Even Medicare Advantage is funded through taxpayer dollars. But the point is, a lot of people would be more comfortable paying a little more a month if it means when something bad happens, they're not out thousands upon thousands of dollars when they're already in a stressful situation. So yeah, I can pay a little more, especially senior market. A lot of them are paying zero premium for their Medicare Advantage plans. Offering a plan for $45 a month can mean a big difference to not only their pocketbook, but their mental stress, their ability to just relax and focus on recovery and not focus on repayments. So you can tell your clients, again, for around $45 a month, we can offset most inpatient hospitalizations, outpatient surgeries, ER visits, urgent care, and more. You can focus on getting better knowing that your co-payments are paid, right? This simple statement right here can mean a world of difference for a lot of your clients. And I've always said, think about this. Let's say you're sitting home this afternoon and your PNC agent calls you. And let's say his name is Mike. Let's say I'm your PNC agent. And I say, hey, Bob, Mary, Joe, insert your name here. For another $20 a month, we can eliminate your auto deductible. So if you're in an accident, rather than pay $1,000 deductible, we'll make it zero. It's another $20 a month. Do you want to add that to your policy? And if you say, would you be like, how dare you offer me this solution to my auto deductible? Click. No, you'd be like, you know what? I'm okay, thanks. And some of you might be like, for the extra 20 bucks a month, yeah, I'll do that. Yeah, go ahead and add it on. I'll eliminate that deductible. Great. Got you done. You're all set. It's as simple as that. That same approach works with your senior clients for another 45 bucks a month, for $45 a month, because they're paying zero, $45 a month for insurance they go to the hospital, have outpatient surgery, have an ER visit, have outpatient surgery, have to put depending on the policy, pet boarding, transportation, excuse me, all the other things that come with it. For $45 a month, I can eliminate most my out-of-pocket costs. Yeah, I'll do that, right? If my group insurance called me and said for $45 a month, you go to the hospital, you pay nothing. Yeah, I would do that. That's a good offer to me. It's probably a good offer to a lot of your clients. Now, do a lot of your clients know about hospital indemnity? Probably not. If you didn't talk about it, they don't know about it. It's very hard to buy what you don't know exists. And I use this example when I was doing the cross-selling clinic last week. I found lightsaber chopsticks for, May the 4th be with you, which was yesterday. So happy Star Wars Day yesterday. Happy Cinco de Mayo today. But they have Star Wars chopsticks. They're not called Star Wars chopsticks, it's called lightsaber chopsticks on Amazon for like $14. Now, I have never eaten sushi and thought, you know what I need right now? Some light up chopsticks. That'd be amazing. But they exist. And now that I know they exist, I'm not going to buy a pair because I always have a fork readily available. Because I ate the first couple of chopsticks and realized I like modern technology with the fork and put them down. But it's fun, right? It's something goofy. I'm a goofy guy. That could be entertaining. but I never thought about it, didn't know about it till I knew it existed. Your clients probably don't know about hospital indemnity, so it's hard for them to say, man, I wish there was a way I could get rid of all these copays. And for most agents, it's called a Medicare supplement. Well, guess what? We could supplement the Medicare Advantage plan with a hospital indemnity plan to offset all those costs, right? We offset original Medicare with the Medicare supplement to offset that 20% and all those co-insurances. You could offset the Medicare Advantage plan for a lot of the copays with the hospital indemnity plan. So don't just switch to 20% co-insurance for fixed copays. Offer a hospital indemnity plan and eliminate them if at all possible. I mean, look at this example. So let's say you have a client that goes to a hospital for 4 days, 350 a day for 4 days. They're in there for 4 days, get out, they owe $1,400. Is that life changing? Hopefully not. Is it a burden to your clients? Probably. But if you offer a hospital indemnity plan, I like overfunding them $500 a day for if they go for 4 days. That's a $2,000 payout. They have an extra $600 for post hospitalization needs. They could go to see that doctor visit. Maybe they have extra medicines because they were discharged and getting rid of an infection. Maybe they have physical therapy they need done. Maybe they want to go to the casino and try their luck. Maybe they want to go out to dinner a couple times. Maybe there are lots of things they could do. Maybe they have to put grab handles in their home now so they don't fall again, right? Well, $600 can go a long way to doing that. So they could use that $600 for costs that maybe they didn't consider and that creep up after a hospitalization. No, is your client going to be mad at you that they have this policy and it gave them a check and now they have extra funds? No, just the opposite. Maybe they'll knit you a cape because now you're the superhero because they went from stressing over paying a bill to having no problem having extra money. And it opens the door for referrals, right? This person, let's say this is Myrtle. Myrtle's going to go have coffee with her friends and she's going to buy the round. And people are like, Myrtle, you're so cheap. Why are you buying all the coffee? And she goes, oh, I got that check for going to the hospital. And her friends are going to be like, you don't get checked for going to the hospital. Maybe you hit your head a little harder than you thought. And she's like, no, 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 no. My insurance agent gave me this extra protection where if I go to the hospital, it pays everything for me and I had money left over. You know what they're going to say? How do we get that? I want money. I don't want to pay copays for the hospital. I want to have extra money left over. And now you get phone calls. So if you're like, how do I get more referrals? That's how you get more referrals right there, right? It's insurance they're probably going to use. And especially when you have plans like Mutual of Omaha and Wellaby, Wellaby has a transportation benefit. If you have rural clients, you've got a lot of rural clinics and hospitals that are closing. So people have to travel for treatment. And if they have a loved one go with them, they could pay for the loved one as well. So lots and lots of bonuses your clients can have with a hospital indemnity plan. So make sure you talk about it. If they say no, that's okay. You did your due diligence as an insurance agent. Okay. So now, if you don't want to bother your clients with all this, you'd rather bother them with medical bills, is what you're doing. Oh, you know what? It's uncomfortable for me as an agent to ask for them for money, for medical, for insurance. Oh, how dare I? So I'd rather just not. Well, when I hear that, you know what I hear? I hear I don't want to take care of my clients because it's uncomfortable for me. And you might be thinking, Mike, I always take care of my clients. But if you tell me that you don't show them all their options because you don't want to be uncomfortable or hear a no, you're not taking. You're an order taker. A true insurance advisor shows all their options, whether or not they're comfortable or not. You know what? It's not easy to ask people for money, but you're not asking for their life savings for an insurance policy like a long-term care plan. You're asking for $45 a month to offset all the stuff that could happen to them. Do your due diligence. I applaud you. And as more and more Medicare Advantage plans say we're no longer paying commissions, how are you going to live, right? If you are if you are so hurt, and I sympathize with a lot of agents that are losing money over plans that are no longer paying commissions, but you have an arsenal of ancillary products that will pay you commission no problem. So if you're deciding that you're no longer going to get paid, that's on you. Because if you're not selling hospital indemnity, if you're not offering life insurance, you're not offering cancer plans, not offering annuities, that's on you. You chose not to offer those things as an insurance agent that you have available. So my sympathy goes so far, and then it's, well, what are you going to do about it? Nothing? Well, that's on you, right? So there you go. You need to pivot. And is everyone going to purchase it? No. But again, I've seen attachment rates with hostile indemnity as high as 70, 80% because people want solutions. People don't want to pay. If you think, well, it's not that bad, guess what? Your clients also are worried about outliving their money, right? They're not retiring at 65 and passing away at 70 anymore. They're living in 80, 90, 100 years old. It's not uncommon for someone to live well into their 90s. That means the 30 years, 40 years they worked has to last them 30, 40 years now. So don't just focus on emergencies and planned procedures. Talk about everyday needs. Now, I'm going to show you some stats that are kind of eye opening. Medical debt with seniors. 22% of seniors carry medical debt. That's 13 million seniors have medical debt. 60% of those people owe more than $1,000. 11% of that 60% owe more than $10,000. So there's a good chance that a vast majority of your people in your book of business, your clients, have medical debt, whether it's just pending debt or credit card debt or some sort of debt that's preventing them from doing things. Like, as you can see, 62% have reported skipping or delaying necessary medical care or prescription drugs because they can't afford it. Now, again, I understand that asking for more premium can be a little daunting for someone that's struggling, but the joke has always been if you can't afford a med sup, you can't afford to get sick on a Medicare Advantage plan, right? Because you go to the hospital, you could very easily owe $2,000. Well, if they can't afford a $2,400 premium, how are they going to afford a $2,000 bill? Plus all the other things that could come with it. 30% have reported collection agencies. So make sure that you're talking to clients about their options. And someone said, you could do the give back plans. Yeah. And that's incredible. And that's been a huge proponent of these. If you're in a market that has a give back plan that gives back money, now they've got extra funds. The hostile dummy plan basically doesn't cost anything, right? They're getting $100 back a month, and you're asking for 45 of it. They're still $60 ahead, and now they have an even better Medicare Advantage plan. So great point, David, on that about the MA give back plans. If they don't have a give back plan, you know what? A lot of these carriers they really want to focus on zero premium because asking for premium is a little harder, right? They'd rather do zero premium with higher copays and higher out of pocket costs because the premium is what they're going to use every month. They might not get sick every month. They might not go to the hospital every month. Hopefully, that's not the case. But point is, if you're so hell bent on having zero premium, the offset is you're going to have more out of pocket exposure when you do get sick or have an injury. And that's when they're really going to wish no one's ever gotten sick and thought, man, I'm sure glad I don't have a check coming in. They're always like, man, I should have bought that hospital thing that my agent told me about. Or I just got diagnosed with cancer. Oh, I should have bought that cancer plan that my agent told me about. I could have $10,000. Now I'm struggling to pay the 20%. And don't forget, if they're living social security check, and they have money in the bank, if they say, "Well, I got money in the bank," well, how much does it cost to pull it out? Depending where that money is sitting, if they pull out $5,000, it could have tax ramifications, it could have penalties. That $5,000 can easily turn to 8, 9, 10, depending on how it's sitting and what kind of account it's sitting in. So, do you want your savings to pay for your illness and injury, or do you want the insurance company to pay for your illness and injury, right? Do you want big difference there? So make sure you're doing a full portfolio sale because your clients are worried about paying. And you could use that in your presentation. Now, again, not everyone's going to say yes, and that's okay. If you are not offering ancillary products, you are 100% replaceable by a 1-800 number. Because you know what those call centers don't do? They don't do a lot of cross selling. They want to get on the phone, sell them an MA plan, get off the phone. Well, if that's what your in-home appointment looks like, or an office appointment looks like, or any appointment you have looks like, you are no better than a call center. And you might be like, Mike, you SOB, how dare you say that? And I don't mean summary of benefits. Well, guess what? Prove me wrong. So take care of your clients. It's okay to hear no. No is fine. If you don't hear no, how do you know all your clients' needs and concerns are met? You don't. So there you go. Now, and again, I'm all for offering options. Here's three options. You got three options. Option one, plan by itself. Option two, we can eliminate a bunch of copays. Option three, eliminate a bunch of copays and have a cancer protection plan in there. Which one you like? Now you give them the choice. So not everything has to be a hard sell. Some of it can be different packages, right? When I pull up to a fast food establishment, like I shouldn't do, but I do anyway sometimes, guess what? There's not one option. It doesn't say burger, fries, beverage. It says option one, two, three, four, five, six. We want choices. Because if you don't offer choices, you're giving your clients an ultimatum. So make sure your clients know their exposure to medical bills, right? I would stress that. If you go to the hospital, you're going to owe at least, you go to the hospital for a week, you can owe $1,500, $1,500, $2,000. Are you okay with that? Oh yeah, I've got $8 million in the bank. Okay, then you're good to go. Well, it's like, well, yeah, I guess it won't be easy. As soon as you start hearing hesitation in your voice, in their voice, excuse me, start to think, well, they need to have options because it's a lot easier to afford $45 a month and budget for that than a $2,000 bill, right? Because a $2,000 bill, let's just for giggles, let's pull up the old calculator because I am bad at math. So $2,000 divided by 12, that's 166 a month, right? So $2,000 divided by 45, that's 44 months. That's almost 4 years. So if they were to pay what they would pay for the hospital indemnity plan for one hospitalization, it's equivalent to 4 years. Put it that way. So hey, you know what? So it is a good value. It's a phenomenal value. You want to pay over 4 years, or you want to get a check and just pay all off at once? $45 a month. There you go. Let's see. So yeah. Kyla, I don't know how you say it. I apologize. Price. There we go. Since it's you sent to everybody, give them options. Let them decide what would be best for their budget. Yeah, and that's the thing is, I am all for offering options. I don't want an ultimatum. I want options. An ultimatum is everything or nothing. So if you're saying, here's your Medicare Advantage plan, that's it. You give them an ultimatum. Everything or nothing. People don't want that. That's why we have options everywhere we go. You go to the grocery store, you ever see a cereal aisle? It's an entire aisle of cereal. You've got options of the wazoo. Coffee, dirty bitter bean water. You got options of the wazoo. Any restaurant. I've never been to a restaurant and be like, here's our dish today. Take it or leave it. They always have options. Even Chipotle, one of my favorite places, still has options. Because guess what? There you go. Yeah, side dishes or the whole plate. Someone just said in the Q&A. Exactly. You know what? Even if they have one thing, I still have options of side dishes. So that's the point. So Deb asked in here, let's see. Let's see. If you were part of the cross-selling clinic, um, you should have got an email today. If you didn't get, I'm gonna put a link to that email in the chat for you all. But just so you know, offer alternatives. Hey, you know what? Here's the most appropriate plan that we have in market. Here are some ways to make it better. And you could say, not for you to say, hey, a lot of my clients add this and this, because they have similar situations, similar concerns, they'll add this and this to it. If you want to do that, great. If not, it's okay. Because you're giving the clients the ability to make their choice, right? If you make the choice for them, that creates buyer's remorse. If they make the choice, you're just their advisor. You're not making it for them. Big difference. So there you go. All right. All right. Let me stop recording. Sorry. All right.